And joining us now from our Abuja studios is Dr. Bassi Okosin, Director, Disease Control and Immunization, National Primary Healthcare Development Agency, the NPHCDA. It's good to have you on News Across Nigeria.
Good afternoon, Olumide. Good afternoon, Nigerians.
Welcome to the program. A quick history lesson, if you will. The country recorded a huge outbreak back in 1991, cholera, 2010, 2014, 2018. Even in 2019, there were about over 43,000 cholera cases and deaths. Now, yesterday in Jigawa, over 100 people died. What is your agency doing to prevent this from recurring again? And isn't it quite easy to prevent?
Okay, just to put it this way, as we go into statistics, as at week 28 in the country, we had about 1,634 cases nationally in 19 states. For this week, the week 29, this number has reduced from 1,634 to 650 cases in 8 states, Jigawa being one of them. I've heard you talk about 1,000 cases aside for Jigawa, but for the records that are available, Jigawa, as at this week, have 201 cases. And then to mention generally, you know, since between January and date, there are about 23 states that have been involved, but currently the active cases are in just 8 states, which Jigawa is one of the states. Now, for what the government is doing, a lot is going on. You can see between the week of 28 and the week of 29 alone, with the multi-sectoral intervention, the cases reduced from the 1,634 in week 28 to 650 in 8 states in week 29. A lot is going on from the national level, and you recall, Bauchi was the real epicenter where we're having over 2,000 cases in a week. Bauchi from the national, going from the agency, National Primary Health Care, we thank the leadership of the ED, the minister, and our president for the effort to facilitate the vaccines that came in. We had about 1.5 million doses of vaccine that was sent to support the campaign in Bauchi State. In a week alone, we have recorded about 74% reduction in the number of cases in Bauchi. And so the same that we have Jigawa, Kano, and Zamfara, and a few other states, the other remaining 4 states, that the efforts are ongoing to support them also to get vaccines, to vaccinate the people in the high-risk LGS. But aside that, we Nigerians have a great role to play to bring down the cases. For instance, the cholera will thrive in an environment where there's inadequate, unsafe water for drinking. It will thrive in an area where you have unsafe waste disposal and fecal disposal. So we'll encourage, and then poor hygiene. We encourage Nigerians to be part of this to ensure that they have safe, adequate water to drink. They should wash their hands frequently, use clean water to cook their food, wash foods before they eat. And then when it comes
Doctor,
to
what
water,
you're saying, sorry to interrupt you, what you're saying is quite true. And that's where I wanted to focus on for just a moment. Why I was asking you whether it's easy to prevent is because it's waterborne in most cases, gastroenteritis and cholera. Is there any parley between your organization and the agencies concerned with the state governments to ensure that there's proper hygiene in these areas and that safe, portable drinking water is made available in those communities?
Yes, we are working with the state governments to ensure that we keep our people safe. I'll give, for instance, this tonight by 8 p.m., the Executive Director, Dr. Faisal, will be having a meeting with the commissioners again to talk about issues and the areas of support with the state. And so what we work with through our state primary care development agencies is for them to work with the various ministries of environment and other underlying ministry to ensure that potable water, safe water is provided in those areas that have these issues. All it takes for an outbreak in a place is one person that is infected to contaminate the water around that area through unethical or poor methods of fecal disposal. For those that go into the bush to defecate, they don't have toilet and areas to defecate, we advise Nigerians we can save the situation.
Okay, Dr. Bassi, very quickly, sorry to interrupt you again.
We are in rainy season.
Dr. Bassi, sorry to interrupt you again. I catch your drift. But finally and very quickly, as far as prevention is also concerned, vaccination, why is the oral cholera vaccine not a part of the routine vaccination in the country? Because this will have just prevented these avoidable deaths where people have lost their lives.
Okay, vaccine for cholera was either not available for routine, but it is a vaccine that has just been developed. Just one country, Liberia in Africa, have so far tried. And then we in Nigeria have also applied for these vaccines for routine. We need a conjugate vaccine for routine vaccination. So the applications will be submitted with the leadership of the Executive Director, Dr. Faisal, the Minister, and the other relevant underlying ministries. We are pushing forward to ensure that we become the second country in Africa to at least introduce it routinely. But what we do now is through the ICG, because that is the only window that is available for the vaccine, on a monthly basis, apply for vaccines to affected community. So there are 7 outstanding states now that for this month of August, we are expecting the vaccines to support.
We hope that going forward that this is what obtains. We'll have to stop there though, Doctor. Thank you so much. We hope that going forward that this is what obtains. Thank you so much for joining us, Dr. Bassi Okwasin, the Director, Disease Control and Immunization, the NPHCDA.